crazy. And they'll be able to theoretically take pictures on traumatic event.
It doesn't look like the second
Those will
hand.
be into the hospital records. When we transfer the hospital record over, they'll go over some attachments. It's really slick.
I'm not a real techie guy, but I
But
just
the
got
best part of that whole
an
system,
iPad
right?
Pro.
We're almost there. We got a little bit more work with one more hospital in Super City. Is the fact that the paramedic can report back.
Where do you set?
That's it.
Okay, you just give me a high side. We're waiting for a moment for the microphones to work.
And the clock too.
I think the clock is hopeless. You think? I had somebody with younger eyes confirm. Yes, definitely. So while we're waiting, is it not nice to be able to watch TV and not hear one political commercial? Wouldn't that be better?
Yes.
Back to pharmaceutical ads.
Wish we'd go back to the old time when you had news at 6 o'clock and then the TV stations, you know, went off the air at midnight and you didn't hear about anything until the next morning.
Yeah, the cycle doesn't stop too. Andy, what's your picky device there? What do you?
It's a Verizon Ellipticus, nice little tablet. They gave it to me for free. I don't know why. $10 a month for it.
Check, check, check. There is a wager about how long this meeting will take. The record shortest meeting ever is 7 minutes. The clock won't start until we start. So you're all in the record book if that happens. Yeah, that's all right. Let's hope.
Never had to do that. Looking by that clock, we're early. We'll be done early.
Well, for you Bakersfield guys, that's really convenient. For me to come 40 miles.
Now, with the time change, will you be looking at the sun on the way home?
What was that?
Will the sun be right in your eyes on the way home? With the time change?
Yeah, a little bit. Big boy, I'm used to it.
So what's your start date?
It is February 1st. She retires effective January 31st. And in the meantime, we're doing a lot of transition. But we've been kind of, I've been shadowing her as well and learning a lot about the operations since I came there in 2009.
Yeah, I'm sure that'll be huge.
Yeah. And then what we do is have the opportunity, the voters can choose. They get to see how I perform for 18 months and they can decide if, I'm the right fit for the job or if they want somebody else. So I know we'll hear pushback from some of the community offices, but county offices are very, very different than districts. And what we do and how we operate is completely different than any other educational system. There's only 58 of them in the state, and you have to reside within the county, and you have to be to be elected, and you have to be you have to have a credential. You know, you have to have that background, educational background. There's other criteria. So.
Okay, let's go ahead and start. The microphones in the room aren't working, but the microphones that tape us for the audio and the playback on YouTube are working. So we're going to go ahead and proceed and just ask everybody to speak loudly today. So in the room, we'll all be able to hear one another. Good afternoon. Welcome to the Thursday, November 10 meeting of the Emergency Medical Care Advisory Board. I'll call the meeting to order and ask Mary Barlow, who is our next superintendent of schools. She will be officially elected into that by her board in December, but Mary Barlow is going to lead us in the flag salute.
Salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Please have a seat. Longer days and nights, though, I'm afraid, Mary.
I'm up for it.
Congratulations, though. Jenna, would you please call the roll for us?
Certainly. Supervisor Maggard.
Here.
Chief Greener.
Here.
Mr. James Miller.
Here.
Mrs. Barlow.
Here.
Mr. Randy Miller.
Here.
Mr. Paul Paris.
Here.
Mr. Bruce Peters.
Here.
Mr. John Surface.
Here.
Dr. Lyon.
Here.
We have a quorum.
Thank you very much. We have a consent calendar today that actually covers most of our items. The consent items are number 5, and on the second page, all of the new business under item number 10, items A through E. Miscellaneous documents are received and filed under consent. Are there any members of the public that would like to pull, or members of the board that would like to pull any of those items for separate consideration? Don't see anyone, so then we, if there's no public comment about that, then I would ask someone to please motion that we approve our consent agenda.
So moved.
Thank you.
Second.
And we have a second. You guys catch that? All in favor, please say aye.
Aye.
Aye. Is anybody opposed? Very good. Thank you very much. We don't have any subcommittee reports today, so moving on to public comment. We always offer an opportunity for the public to speak to us about any matter that's not otherwise on our agenda for the day. Are there any members of the public that would like to make comment to us this afternoon? If you do, would you like to? Oh, he's just moving his water. Okay. I don't see anyone, so we'll move on from there. We don't have any public requests or any unfinished business. We have a director's report, I believe. Ms. Richardson?
Thank you. I just want to give you guys a quick update about what our division's been working on. We are continuing our efforts to increase the number of people in Kern County that are trained in CPR. So in the month of October, we had 4 different training sessions that we held. We went to mental health and trained several of their employees. We had 19 people that were trained at 4 different sites for behavioral health now. Here in the building on October 14th, we provided CPR and AED training, and we also created an AED video for Facebook. So we trained 26 people in CPR and AED, and the video is posted to YouTube and our Facebook page for the public to view on instruction for CPR and AED use. October 18th, we went to Americans Job Center, formerly known as Employers Training Resource, and trained 27 people in CPR and AED use. And then October 29th, we sent staff to the Chupacabra Run and provided CPR and AED training for 26 members of the public there. So again, we're continuing our push to train hands-only CPR and AED use in the community. With our AEDs, we recognized after the Erskine fire that we had a gap in services for the shelter, and so we've recently purchased 3 AEDs and gave them to the Department of Human Services to deploy to shelters. So when there's shelters that need to pop up, they'll have AEDs on location now. And continuing with our push even further with our Pulse Point, we October, we've reached over 1,000 people who have downloaded our PulsePoint app. So we now have 1,000 community members in Kern County that have PulsePoint, and we have over 174 AEDs are currently entered into the application. And that concludes my report. I'm available for any questions.
Any questions by anyone? Members of the public about the report? Do we need to receive and file your report, or does it not matter?
Council?
Did you ask for a motion on receiving file?
Should we do formally receive and file? Okay, is there a motion to receive and file the director's report?
So moved.
Thank you. Is there a second?
Second.
All in favor, please say aye.
Aye.
Aye. Is anybody opposed? Thank you very much. Okay, board members, do you have any reports or things you'd like to tell us this afternoon? Start on this end down here. Any board members? How about the other end? Very good. I have a couple of announcements to read to us. First is that our next regularly scheduled meeting is February 9, Thursday, February 9, 2017, hard to believe, at 4 p.m. in this very room. And if you would like to request to have an item placed on that agenda, the deadline for doing so is the Thursday before, I guess 2 Thursdays before, January 26th at 5 p.m. at the EMS Director's office. So are there any other matters before us this afternoon? If not, I would entertain a motion to adjourn. Very good. Without objection, so ordered. I don't think we made the record, but
You did.
Good
You
work.
are at 6 minutes.
oh, really? Congratulations,
Couldn't tell by
all.
that clock, though.
Yeah. Happy holidays, everyone.
Thank you.
Thank you.
Gee, that was fun.